I'm Sarah Garrett. I'm an assistant professor at UCSF's Philip Arley Institute for Health Policy Studies and also the Department of Humanities and Social Sciences. And these days, I am thinking about how to make an impactful, ethical, sustainable career in research, working in collaboration with the communities most affected by the topics I'm studying. And I am focusing my research on maternal health, specifically inequities in domestic maternal health. Currently, I'm concluding a project that focused on perinatal clinician implicit bias training, and I'm launching research that focuses on how health systems, specifically hospitals, are working to try and reduce racial and ethnic disparities in their outcomes. And this focus, sort of tracks what has been going on in the field more broadly, which has been a shift from trying to improve maternal health outcomes by focusing on patients and trying to make patients change their behavior or decisions, shifting to how do we intervene on actually what clinicians are doing, what health systems are doing. So both interpersonal, clinician level and also health system level changes and interventions. So I'm interested in this because as a social scientist, as a sociologist, it's sort of baked into me that I'm interested in how systems work. I also am very interested in how people here, clinicians in particular, are understanding what's going wrong, what needs to change, what is reasonable and important. But I'm also drawn to this because it's such an important problem in our country. The United States has worse maternal health outcomes than its peers, their countries. And our maternal health outcomes are driven by inequities, which are disproportionately burdened by Black women and birthing people, Indigenous people, and other subgroups, depending on what region you look at. And the CDC recently determined that, for example, for pregnancy-related deaths, up to 80% of them are preventable. And we know that maternal morbidity is, much of it is preventable. And there is, in a nutshell, there is great room for improvement here. And I think it's morally important that we work on this. And being at a large academic medical center, being a white person, I have access to healthcare institutions, and in my networks, I have access to these health systems. So I am hoping to use my position and resources to try and understand what is happening, how might we make things better, and to create those networks and collaborations to try to reduce inequities in maternal health in the US. That's what I'm doing in a nutshell. And if you're interested in these topics, please reach out. Thank you.